Hi everyone. Today we are going to discuss about hypercalcemia, that is excess of calcium in your blood. So we will today discuss what are the causes of hypercalcemia, how we can treat it, what are the symptoms, and what are the complications associated with the hypercalcemia. Calcium is an essential mineral in your blood, which has got multiple functions, including conduction of impulses through the nerves, also helping with the clotting of the blood, and help with the bones health as well. So this has with multiple uh, important functions in the body, so it is very tightly controlled to make sure it's in the normal range. In hypercalcemia, due to the various pathological conditions, you get an increased level of calcium in your blood. Surprisingly, chronic hypercalcemia can be quite asymptomatic, or at times the symptoms can be quite vague, like muscle pain, fatigue, constipation. So a lot of symptoms which are not very specific, which can come with other medical conditions, can be present in hypercalcemia. So it is usually picked up on a routine blood test done for something else. The most important cause for a hypercalcemia is an overactive parathyroid gland in your neck. So parathyroid gland produces a hormone called parathyroid. This increases calcium in your blood. This acts by multiple levels, including on your bones and kidneys and on your gut, thereby keeping the calcium levels in the normal range. In hypercalcemia due to primary hyperparathyroidism, where there is excess of hormone, which is um, inappropriately high for the level of calcium and draws more calcium into the blood. Second cause usually could be associated with a cancers, which affects the bones, which goes into the bones and causes lesions in the bone, thereby increasing the calcium. In this condition, usually your parathyroid hormone will be low or suppressed, so that it's not related to your parathyroid hormone, it is appropriately suppressed. Excess of vitamin D intake, and also with the kidney disease, which are long-standing, can develop hypercalcemia as well. This is called tertiary hyperparathyroidism. It is rare, but it can happen in chronic kidney disease patients. Full stop. The next thing we need to investigate is obviously by looking at the calcium levels in the blood and also the PTH. If the PTH is high, it's more than likely this is due to an overactive gland in the neck. So you do further tests to find out which gland is overactive, and treat them by surgically removing it. The second cause, cancers, you treat the hypercalcemia in the acute phase and look for what sort of cancer is causing the hypercalcemia and treat it accordingly. In kidney disease, you can do hypercalcemia treatment by giving controlling the kidney functions, and also in controlling calcium binding agents, using calcium binding agents, etc. For acute hypercalcemia, which are symptomatic, coming with severe symptoms, the usual treatment is giving lots of IV intravenous fluids, which helps to rehydrate them. Usually these patients are really dehydrated, so you need to give them 3 to 4 liters of fluid to see their calcium levels are dropping, so that they can treat it with other agents. So initial few days, you monitor their calcium levels, you do an ECG to make sure your QT intervals are okay, and look for a cause. And then if it is not coming down even after adequate fluid hydration, you could try a bisphosphonate like a zoledronic acid or pamidronate according to the kidney functions. So the complications of hypercalcemia due to parathyroid hormone excess would be, it affects the bones. Obviously, the calcium is coming out of the bones, The bone becomes thin, causing osteoporosis. Can also get deposited calcium salts in the kidneys, causing calcium stones in the kidneys, and sometimes you can develop pancreatitis, confusion in acute states, etc. We always do a 24-hour calcium in the urine to make sure it is not a rare condition called familial hypercalcemia. This is more relevant in chronic mild hypercalcemia. If it is due to familial hypocalciuria, if the usual treatment, you don't need any treatment, so it is but just wait for watching. So it is important to make the diagnosis before you proceed with the surgical options. So in summary, hypercalcemia is a serious condition. First thing to identify what is causing the hypercalcemia, treating them accordingly. Doing a parathyroid hormone initially will help us to guide our investigations in the right direction, treating it, and then identifying the underlying cause and correcting it. Hope this video was useful. Thank you.